So we invite Dr. Peter Edelstein, medical doctors. Dia adalah dokter bedah dan dokter bedah digestif dari Florida, dan dia bicara mengenai decision support system, bagaimana bisa mendukung atau mendorong patient safety. Please, maybe you, okay. Yes.
Good morning. If you could put up my slideshow, since I don't speak that language very well. Now that is a good talk. I'm not anywhere near his age, and he has way more energy than I do. So very impressive. So if you can put up my slides, please. Thank you. I'm Dr. Edelstein from the United States. I'm going to give this talk in English because that's the only language I speak. And my children even tell me I don't speak that very well. I'm very proud to be the Chief Medical Officer of an international company called Elsevier. By training, I'm a surgeon, cancer surgery, and trauma surgery. But in my role with this company, I have the privilege of traveling all over the world. So this is not my first time in your wonderful country, and it's an honor to be speaking here. I love coming here. Earlier this week, my colleagues and I were in Australia, and prior to that, we were in Korea, and right before that, I was in Brazil, and in Spain. And no, I have not seen my wife in a long time, you're right. Next week I'll be in Dubai and Abu Dhabi, and England, and France, and Italy. And then I'll go home and see if my children have grown up and gotten married, and if I have any grandchildren. But one of the great privileges of traveling to so many places, besides having the best food in the world right here, one of the great privileges is in my role with this company, I get to spend a great deal of time, not just in conferences, but meeting healthcare visionaries and leaders from around the world. I work with people in the top hospitals in the world, the top hospital systems, and I spend quite a bit of time with people in the ministries of health all over the world. And you really learn a lot about how the best systems work. And it's always interesting to me that the same issues that you're speaking of here, we talk about in Beijing, New York, Amsterdam, London, Barcelona, right? Because as big as the whole world is, there's one thing everyone seems to have in common. Everyone is either a patient today or is going to be a patient. That's the reality. We all struggle with how to bring the best care at the lowest cost to our patients, our mothers, our sons. So in my travels, I've picked up a few things that I'd like to share with you about what is called in the United States and Europe, particularly clinical decision support. It's just a fancy way of saying the best information. How do we use the best information at the best places in the world to drive patient safety? So we'll begin. Many places in the world, particularly countries with very large populations, share a similar problem. They have a limited number of hospitals for inpatient care. They have a limited number of specialists. And then they have many more community health centers, outpatient offices, and many more general doctors. Now that makes a lot of sense, right? I mean, most diseases you shouldn't have to come see a cancer surgeon for. The problem is this. All across the world, and I've seen this all across Asia, people who think they're sick or feel sick don't always go to the right place, right? So someone coughs, the first thing they say is, I have to go to the hospital and see a pulmonologist, a chest expert. It's a cough. Your daughter has an earache, you want to take her to the hospital and see the ear surgeon. So the problem is, how do we know who should go there and who shouldn't. Because when everybody goes to see a specialist and everyone goes to the hospital, you waste a lot of money. You waste a lot of resources because you do all sorts of unnecessary tests and activities. And this is true in Indonesia, and this is true in Japan, and this is true in the United States, it's true in Europe, it's true in Saudi Arabia. Not only that, when people get admitted to the hospital who really shouldn't be in the hospital, when you could have prevented their disease, you take up a hospital bed that is needed by somebody else, right? In the United States, you've heard of Obamacare. You've heard of Donald Trump. You've probably heard of Obamacare. The real goal of Obamacare is to remove about 1 out of every 3 hospital beds. Make them go away. Now at first that sounds crazy, right? But when you realize in my country, 10% of people in the hospital are there because they did not take their medications correctly. Well, we should be able to fix that, right? Should not we be able to help my mother understand how to take her medicines? A lot of the beds are taken up by diabetics because they aren't being taken care of at home correctly. Heart failure patients fill hospital beds because they're not taking care of themselves. That's not good care. So how do we identify the small number of patients who are ill who really need to go to the hospital? The small number of patients who really need to see a specialist, not a generalist. How do we get people to go there who need it? Well, the huge number of patients who are sick go to the community health center and see a generalist, which is what's mostly needed. That's the big challenge. Why is this happening and how can we correct it? Because if everyone waits in line in Jakarta to get into the hospital because they have a stuffy nose, you've got a problem. And you do have a problem. So, why do people do that? In most places, the average patient thinks that the hospitalist and the specialist are better, right? I mean, that's the reality. People always want to go to the specialist, and they believe that the hospital is a much better place. And so why would I go to the community health center, which has generalists and worse care? This is a problem throughout the world. Whether it is true or not may not matter, because that's what patients believe. I would have patients in my cancer practice at a very famous hospital called Stanford University. Very prestigious, very famous. I'm a specialist. And I'll still tell you that at least 10% of my patients did not need to see me. They could have seen a general surgeon in a public hospital and would have been just fine. But they travel all the way across the country because they think that only a specialist in a famous hospital should remove the mole from their hand. Right? This is a universal. So the real task that we have as healthcare providers, as hospital leaders, as government leaders, the real goal has to be to have the best care for our hospitals and our community health centers, to have the best care for specialists and generalists, and to show the people in the population that we have the best care wherever they go. So how do you do that? How do you make sure that you have the highest quality care that costs the least money everywhere? Now, lots of times, particularly in places like the United States, people will tell you that you can't have the highest quality care for less money. That doesn't make sense, right? Because if I have a really bad car and I want a really nice car, that costs more money, right? That's just the truth. If I am eating at McDonald's, which is not good food, it costs very little money for me. If I want to eat at a wonderful Indonesian restaurant, better quality, that costs a lot more, right? So everybody around the world says, this is impossible. We can't have better care for less money. But that's not true. In healthcare, It is the opposite. Let me give you an example from my own practice, and my colleagues will have the same experience. A 60-year-old man comes in with a cancer in his intestines. It's blocking his intestines. I do an emergency surgery on him, okay? But I don't do a very good job. It's late at night, and he ends up in the intensive care unit, right? We know what that is, right? In the intensive care unit, a nurse accidentally gives him the wrong medicine, and his kidneys stop working.
Time is running.
Yep. So that's very, very expensive care. But if indeed he had gone and had a study ahead of time, he wouldn't even have gotten his cancer. Better care costs less. So how do we do that? Well, how do they do that at the best hospitals in the world? How do the best healthcare systems around the world who we work with have the best care? I'll tell you how they do it. They do it with information. They use what we call current, credible, evidence-based information. In other words, the same way that your daughter would be treated at Harvard or their Mayo Clinic is the same way she should be treated in Jakarta or Beijing or in a little hospital in India. Information is power for patient safety. You have to have the best information. It can be delivered very expensively through an electronic medical record. That's fine. It can be delivered on your iPhone or a pad, or it can be delivered on a piece of paper, right? If my wife needs treatment for cancer, I don't care if that comes on a computer or if it's written on a piece of paper how to take care of her, right? Information is power. And the information you have to have is good information for doctors, the right information for nurses, and absolutely, as my colleague says, patients must understand their health. So let's talk briefly about doctors and patients. For doctors, there are two types of information that we use. This information allows the generalist or the specialist to deliver the best care for the least money. One type of information are called reference solutions, and I'll show you an example. Another are for radiologists who need special types of information because they look at pictures all day. So imagine there's a patient with chest pain, and my colleagues see this all the time. The chest hurts. Should the patient go to the hospital and see a specialist? Should the patient go to the community health center and see a generalist? That's an important question. How do we answer that if you're a doctor? Well, if you're a doctor and you have the right tools, you can very quickly, in about 1 minute, look up the information that tells you about this type of chest pain. You can look at the most recent books from around the world, the most recent journal articles, clinical trials. You can look at medications. You can give your patients information. You can look at videos. And pretty soon you learn that for this patient, here's what you should do. And in fact, most of these patients with stable angina, stable chest pain, do not have to go to the hospital and see a specialist. They can be taken care of by an informed generalist outside of the hospital. The patient who comes in with shortness of breath, they get an x-ray. They have trouble breathing. Should they see a chest doctor in the hospital and take up a hospital bed? Or can they be cared for outside of the hospital? Well, x-rays can be confusing. If you're the general doctor and you see this x-ray with all these abnormalities, you may or may not know what to do with that patient. But information helps the doctor in this situation as well. There's so much information available now through clinical decision support solutions. Our solution alone has 200,000 x-rays. And the doctor puts up the patient's x-ray and can quickly find a similar x-ray out of 200,000 x-rays. They can figure out what the diagnosis likely is. Look at the anatomy. They can see procedures. There are 20,000 teaching cases that they can learn from. So, no matter where you are in the world, you can rely on experts from around the world. Right there on your cell phone, right there on your computer, anywhere that you practice for any type of disease and any kind of x-ray. That gives a lot of power to doctors, and it helps drive patient safety. You get wonderful information from the best doctors from Indonesia, Australia, the United States, anywhere, right at your fingertips, so you can look at those patients and look at their x-rays and very quickly know this is lymphoma. And then look up lymphoma and find out the patient doesn't need to be in the hospital. The patient needs a specialist doctor, but does not have to take up a hospital bed. You can look at the other x-ray and very quickly see this is a type of pneumonia. You can look it up and within 2 minutes understand that this patient doesn't need a hospital and the patient doesn't need to see a chest specialist. That the very best care can be done right there in your hospital. Do we have proof that this works around the world? Quite a bit. I'll give you an example. In New Zealand, using some of these types of tools, we have over 90% of all the general doctors using this kind of information. Does that help patient safety? Yes. They have seen a 50% reduction in hospitalizations for children with asthma. 50% because doctors now have information. They've seen a statistically significant decrease in strokes. That helps people. That saves money. They have vastly improved control of blood sugar in their diabetics. So empowering doctors with information drives patient safety. And just as my colleague was saying, the most important group are patients. You must partner with patients. So you have to have information available for patients. It can be, as you see on the left there, a simple picture with words on it that help patients understand their pain, their disease. It can be, this is very important, it can be information very simple on how to take your medications. It can be pictures or even videos about a surgery or a disease that they have. And the key for patients with these patient engagement solutions is that it has to be localized. What does that mean? Your patients understand things differently than American patients. American patients understand things differently than Russian patients. It has to make sense for your culture, it has to be in the right language, and it has to be at several different levels of education because people learn differently. This information empowers patients. It allows them, as my colleague has stated, to make partnerships. It helps improve safety for your populations. It reduces unnecessary hospitalizations. It reduces unnecessary outpatient visits. And it greatly drops the cost of care. So we can have better, safer care for less money. It works. Want an example from the real world? Look at Great Britain. Great Britain uses one of our solutions like this for information just for patients. It's used by more than 10 million British patients a year. Now they can get information two ways. They can use a computer, ask questions about their symptoms or their disease, and a very sophisticated computer system gives them the exact type of information they need. They can also pick up the phone and talk to a nurse who uses our information to help the patient. Does it matter? Yes. In the very first year, 1.3 million patients used the information and learned that they did not need to go to the emergency room. They were fine at home or seeing their general doctor the next day. That saved 57 million pounds in 1 year. Information for patients and doctors to partner is better for the patients' lives and costs a lot less money. So in the end, what we're saying is, information for doctors and patients allows us to deliver the right care in the right place. Some people need the hospital, most don't. Some people need to see a specialist, most people don't. So we can determine who should go to the hospital for their care or who should see a specialist. Who should be in the community outpatient center, who should see a generalist. And many people simply can get good care at their home and not have to use either with the right information. And when we do that, as my colleague said, patients are more satisfied. And our job is to make patients satisfied and healthy. There are fewer unnecessary hospitalizations, more hospital beds for people who need them, and much less waste of money and resources. Again, I greatly appreciate the time. It's a privilege to speak here. I'm happy to speak with you later outside. I hope you have an excellent conference. Thank you.
Thank you very much.